Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. Please, if you have not subscribed to my channel, kindly click on the subscription button and turn on the notification bell. Anytime I post a video here, you'll be notified, and then you can quickly come here, and then whatever opportunity that I have posted on my channel, you will get access to it. Today, the video is going to be very short. I get asked a lot of questions from Ghana, especially from nursing assistant. All right, so basically nurse assistant, it's somebody who has gone to nursing school for 2 years, and at the end of your studies you are issued with a certificate in nursing. But then this is either in nursing assistant clinical or nursing assistant preventive, which is popularly known as NAC and then NAP. So NAC and NAP people in Ghana, I think Nigeria, they also have something like that where you go to a nursing school, but it's for a duration of 2 years, and at the end of the 2 years you are issued with a certificate. And the good thing about these certificate courses is that at the end of your 2 years studies, you would write a licensure exam to the Nursing and Midwifery Council, and when you pass, you are issued with a PIN where you can work in a hospital as a registered nursing assistant, either clinical or preventive. So a lot of people are so much focused on healthcare jobs in the UK, carer jobs in the UK, but they don't know that they can register with the UK NMC as a nurse associate. And this particular role is good for those that have done certificate courses and they have a registration with their home country NMC. So if you are in Ghana and you are a NAC or you are a NAP, you have the opportunity of registering with the UK NMC as a nurse associate, and then you can get into the country and come and work as a nurse associate instead of a healthcare assistant or a carer. And the good thing about the nurse associate is that, one, you are registered with the Nursing and Midwifery Council, and then two, your rank is also higher than that of the healthcare assistant or the carer, because nursing or nurse associate are band 4, and then healthcare assistants or carers, the highest you can get is band 3. Basically, the higher your band, the more you earn. You understand? This is simple, more like simple mathematics. So I'm just going to show you the processes that are involved in applying for this nurse associate role. So first of all, you have to be registered with the UK NMC as a nurse associate first before you can start searching for nurse associate jobs with hospitals, with most of the times they work in the hospitals, that's the NHS. So once you apply and then you are lucky, you might be able to get yourself an offer letter, COS, and then you will be in the country and be practicing as a nurse associate instead of a health care assistant. So I want to send you to my PC, and then we'll have a little read about nursing associate. So as you can see, we are in my PC, and this is the official site of Nursing and Midwifery Council of the UK. As you can see, it says that we regulate nursing associate. We regulate nursing associate who bridge the gap between health and care assistant and registered nurses. So basically, nurse associate in the UK, they are in between nurse, healthcare assistant and then the registered nurse. Just like in Ghana, where nursing assistant help nurses to do their work, is basically the same in the UK. Here we have carers, we have healthcare assistant, and then we have the qualified nurses. So if you're a nurse associate, you are in between them. And there are so many things that a nurse associate can do that is very similar to that of the qualified nurses. Something like administration of medication like tablets and, those medications that like tablet suspension, those ones you can give, with the exception of like IV medications. There are some form of restrictions, like you cannot work on your own. You cannot like a whole shift and it will just be a nurse associate. No, you always have to work alongside the qualified nurse. So it's much similar to what the nurse assistants do in Ghana. All right. So basically, they bridge the gap between healthcare assistant and then the qualified nurse in the UK. Let's go on. So you can see that what is a nurse associate? A nursing associate is a member of the nursing team in England that helps bridge the gap between health and care assistant and registered nurses. Nursing associates work with people of all ages in variety of settings in health and in social care. The role contributes to core work of nursing, freeing up nurses to focus on more complex clinical care. It stands alone role that also provide progressive route into graduate level nursing. So basically what happens is that if you're a nurse associate and then you practice for some time, it becomes very easy for you to enroll in the nursing course and then you become a full-time nurse. So if you're a nursing associate, you need to take a course for a certain number of years, and at the end you are also assessed and then you become a qualified nurse. It's much easier for you if you're a nurse associate. And the good thing about this is that some hospitals even gives you the opportunity. They normally advertise that they need people who want to become nurses, and then if you're a nurse associate and you apply, you are more likely to get. And then the good thing also is that they even fund these courses, so they're going to send you to university or the college for free, and then at the end you come back to the hospital and work for them as a registered nurse. So basically that is the description for nurse associates. Now I know what you have been waiting for. How do you apply for a nurse associate work in the UK? First of all, if you're a nurse assistant clinical or a nurse assistant preventive in Ghana, NAC or NAP, what you need to do is first you need to write IELTS academic. I know that this is the part that a lot of people don't want to hear or a lot of people are running away from. But if you want to register with UK NMC as a nurse associate, you need to write the IELTS. And then you need to write the IELTS academic. And then just like the nurses who need to get an overall of 7, with 7 in reading, 7 in listening, and then 7 in speaking, and then a minimum of 6.5 in writing, is the same for you who also wants to register with the UK NMC as a nurse associate. So you need to write IELTS academic. You can also write UKVI academic. It's also accepted. So either IELTS academic or UKVI academic. And then you need an overall band score of 7 with at least 6.5 in writing. Once you have your IELTS pass, the second thing is to register with the UK NMC as a nurse associate. All right. All you need to do is that you just log onto their site. This is their site that I am on. And then you can go to registration. When you go to registration, NMC online, then this shows up. Then you can start. This is online. So you just scroll. I'm trying to see whether I'll be able to show you how to do that, but then I'll do a separate video on it. This one is like a general overview. All right, so you can see the page. I'm already registered with them, so you can see my credentials have already been pre-filled. But if you are starting, what you need to do is you go to register, and then you can start. I have an NMC PRN, I have an NMC PIN, basically I'll just go to register. Yes, so what I'm going to do is that I would do a separate video on how to register as a nurse associate. This one, I just want to give a general overview of it. So basically, this is the Nursing and Midwifery Council website. You go on, you register with the Nursing and Midwifery UK as a nurse associate. When you register with them, you would pay a certain amount of money, which is I think £140 for the registration. And then you will upload your document, your nursing certificates that you have, your nurse assistant certificates that you have. They will require some other documents, form of identification and all of that you need to upload. When you are done with it, then you now go to your home country. So if you are in Ghana, for instance, once you are done registering on the site of UK NMC, then you go to your home NMC in Accra. Then you go and do what we call clearance. All right, you go there, you pay a certain amount of money, which my time it was 550. And then once you are done with that payment, this is what is going to happen. UK NMC is going to communicate with your home country NMC, and then in that communication, all they want to know is either you are actually a nurse assistant in your country and you are in good standing. Once they confirm to them that you are a nurse associate and then you are in good standing, then they are now, UK NMC is now going to email you with a decision letter. The decision letter is basically a letter that will tell you that we have actually confirmed that you are a nurse assistant in Ghana and you are in good standing. You can go ahead and take the CBT exams. So to be able to join the register of the NMC, just like the general nurses, you need to take a CBT. And then when you are done with the CBT, you need to come into the country and then take the OSCE. So once they give you the decision letter, they are giving you the go ahead to book for your CBT exams, and then you write. Once you book for your CBT exams, you write and then you pass. Now you have IELTS. Now you have Nursing Associate CBT. Now the job search starts. So you now start to search for jobs in the UK. So you will search on Track Jobs, you will search on all the other sites that I've always been showing you. You will search for them. I'll do another video solely searching for nursing associate jobs. So once you search for them, you do your application and you are lucky to land yourself an interview. When you pass, they give you an offer letter. Then subsequently, it's followed by a COS. Then they get you into UK. Once they get you into the UK, whichever hospital got you here, they are going to prepare you for your OSCE. And then once you take the OSCE and you pass, then you are now a UK registered nurse associate and you are on band 4. The nurses are always on band 5, and then you will start from band 4. And then that is it. You're a nurse associate in the UK and you work in the hospital. You can give some medications, not all. You can give some medications. You can undertake some nursing procedures, probably under supervision. Then basically you just act like a nurse or you work like a nurse, just that there are some restrictions. Just like in Ghana, if you're a nurse associate, there are so many restrictions. You can't do some IV medications, you can't there are so many things already that you cannot do as a nurse assistant. Just like that, that's the same thing that will happen to you in the UK here. But as I've already said, sometimes when you get these roles, some NHS trusts or some hospitals might want people who will want to go and further their education to become general nurses. And once this opportunity comes and then you apply, because you're already a nurse associate, the probability of you getting this opportunity is very, 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 very high. So basically, this is the roadmap to becoming a nurse associate in the UK. If you are a registered nurse assistant, whether clinical or preventive, in Ghana or in Nigeria or whichever country you are, the criteria is that you should have gone to a nursing school, you've been issued a certificate, you are registered with your home country NMC, and then you have you basically have PIN to practice in your home country. And then that is it, as simple as that. So my nurse assistant, my NAC, my NAP, don't be so much focused on the healthcare assistant and carer jobs. You can actually register as a nurse associate in the UK. Make sure you study for your IELTS, write your IELTS, register with the UK NMC, take your CBT, and then you can start searching for jobs. As simple as that. So in my next video, what I'm going to do is that I'll be sharing my screen with you and I'll show you how to register with the UK NMC as a nurse associate. And then the second thing the second video I'll also be doing is that I would research on nurse associate jobs on the various sites, and then I'll do a video on that. I'll post the link so that you can click on them and apply to these nurse associate jobs directly. As simple as that. Alright, so that has been the video for today. My name is Enos and this is Work and Wonder. Please, if you have not subscribed to my channel, make sure you subscribe and turn on the notification bell. And these videos that I have made mention of, immediately I do them and post them, you will get a notification, and then you just come here and then you do your application. Until we see ourselves in our next video, it's a bye for now.